It's an honor to be here and also at the same time sharing dais with Fidelity's chairman, Mr. Achyut Gowda, very good friend of mine. He's one of the growing entrepreneurs of this country today. I'm so happy for him. And he's also involved in giving back to the society. We all should give back something to society. And he has realized it at a very early age. And he is doing all this social services and things that are required for human beings and environment to protect all of us and to protect the next generation. It's a mammoth task he is doing. I really congratulate him at the very outset, and the society needs more people like him. We have our IPS officer, young and dynamic, Shilpa Devraj, and who's got immense experience both in IT and now into administrative service. People like him are the policy makers. We were just discussing about the policy making for this state, the city and the country. People are required to have good vision. Mr. Prasanna, who is my old friend actually, and he is the one who sends message to everyone every day to remember something about the environment, how we can protect our environment and make it grow along with us. And Mrs. Suhasini, who has organized this event. And I read about the Shilpa Foundation and their task, how they are trying to help the downtrodden children, needy children, and also now this kind of cause of giving blood to somebody who needs. So blood donation actually, as a doctor and a surgeon, I have seen very, very closely since last 3 decades. The blood donation concept started in 1940s, early 40s probably. And ever since then, it has evolved with so many myths along with it. The myths getting solved, some more myths getting added. It's an era of, science developing. As we go deeper into the research, we dig more. Probably what we know about the science, human body is maybe 10-20%, and it's so much to learn. You all know about it. You're all educated class, and you keep knowledge about the day-to-day things. My first exposure to blood donation, massive blood donation, was way back in 1984. There was a big tragedy in Mysore during the shoot of Sword of Tipu Sultan. The Sword of Tipu Sultan, you might have watched, some of you might have watched the serial. Some of you might have just heard about it. There was a big tragedy, and in the Chamundeshwari studio, there was a fire breakout. And many people died in the tragedy, and about 150 people were rushed to KR Hospital, where I was working as a student leader. And the call came to me at midnight and asking all the students who were staying in the hostel to rush to the hospital. I took about 150, 200 of my friends who were in the hostel and went to our hospital, KR Hospital. Those days, the government setup were the best ones there. And we had a huge setup, and believe me, they were all piled up in the ambulance. It was like, crumpled mass. They were all shifted to the hospital, and we saw the real tragedy the first day, and the need for the blood transfusion for those burns victims who were losing. As you know, in burns, we lose our plasma, we lose our fluid, and immediate replacement is the choice to make them survive along with antibiotics and other protections. And that was the day I learned that this is the most, as Deshpande, Mrs. Deshpande was putting it, Raktadana undu Mahadana. This is life-saving and such a precious thing. And that day, we made a list of all the students from across the city. I went on to become the vice president of Mysore City Students Action Committee, and we made a big list of all the students from Mysore City to donate whenever it's required in the care hospital and in other small setup in the city, and that became a very successful one. And even today, people are continuing there. And after I joined Kempegowda Institute of Medical Sciences here, which is one of the prestigious institutions, we have a list of students, doctors who are donating. I should just quote one of my professors, Dr. Kaulgod. He was from Hubli, if any of you are from Hubli, and he was a very popular gynecologist and who served many government institutions like Hubli, Mysore, Bangalore, BMC and all. He was the doctor probably who was, those days of course there were no Limca records, Guinness records and all that. He was the one who donated maximum number of times. As I had heard, I worked with him for a few months, he had donated about 140 times in a very short span. And he used to carry 2 bottles of blood in his hand and walk into his own operation theater, then start transfusing, then operate on the patient. He was a fantastic gynecologist who taught everybody the importance of surgery as well as donating blood. So all memories go back to that. Blood donation had, Prasanna asked me, Dr. Kellow Math Heltaranta. Of course, there are myths, but all the myths you would have read now, you are educated, as I said, you all know blood donation absolutely has no side effects on the human body. It's the regeneration which happens within us that can replace the blood within a month's time. Probably 28 days to 38 days, regeneration of the whole blood takes place. We donate 1 unit of blood at a time, that's about 400 to 450 ml, which gets replaced very quicker. And we have so many components today which are required for the specific diseases. We process it in the center with centrifuge and other methods. So plasma donation or platelets donation or only red cells donation or the whole blood donation, what we call white blood, red blood, and all that. All those components are there, and this is all for the particular diseases. The more you donate, more regeneration happens. But donating blood once a year, twice a year at least, as Achyut mentioned, will definitely help you and help the families in need. We have gone through such a tough situation. People have died. People have died for lack of blood in the government setup in the rural areas when there was no process of storing. The biggest problem with blood donation is how do you store, where do you store? If you don't store it properly, it's going to lose all its nutrient value and it's just useless. And sometimes it may cause severe reaction. People have died because of blood transfusion. So the most important aspect is not just how you draw, but how you store and when you utilize, how you utilize, all those technical things. Of course, it's not required for you people, but what's important is, I say when I was working as an intern and PG, we have literally lifted the sons, the daughters from the ward attendants. They were the attendants of the parents into the operation theater, into the blood bank. We have forcibly tied their hands and legs and taken blood from them. They never realized that the father would die in the next half an hour, 1 hour if they don't donate blood. We have faced such situations and we have requested doctors to donate in emergencies. All these have made us, learn in the long run that how important it is. I urge all you all youngsters who are here to consider this. We spend our time, of course, in the present day, I see a lot of people consuming the junk food and the nutrients which are not actually advocated by the doctors and the approved bodies. It causes a lot of harm and damage to the body. The behavior of the people who are building up, I don't want to take up any name here, in the recent past, in the last few days, what you are watching on the television and everywhere, people behave abnormally and the mood swings, all that happens instantly because of these wrong supplements, wrong food that we are consuming, and the, of course, the drug abuse and the alcohol abuse. All these are leading us nowhere. So youngsters are the next generation. We are almost stepping out. So you are the one who going to build. As he is rightly said, there is no caste creed for blood donation. We don't, blood never asks. In fact, we take blood from everybody, give it to anybody and everybody, even the organ donation. All of us should motivate our colleagues, our friends in groups, make lists in the apartments, in the offices, in the hostels, in the society, wherever you live, and try to help the society in coming up. So I'm very thankful to the organizers today for giving me such a wonderful opportunity. And I always promise Achut that I'm always there for the Shilpa Foundation in any of their activities that they plan in the future also. Whether it could be a medical camp or anything related to health sciences, I'm ready to come forward. And Mrs. Deshpande, it's a very fantastic, noble cause. I appreciate Prasanna's presence, and our IPS officer has taken his time in his busy schedule. Thank you very much for giving me an opportunity. Wish you all the best.